My name is Courtney Cuboni, and I'll be going over the structural and functional units of synovial joints. Here in this video, I'll help you get a deeper understanding of how synovial joints are diathratic, the 6 different types of synovial joints within the human body according to their function, terminology such as origin, insertion, and range of motion, and get to identify and understand how the 3 different types of levers work with synovial joints, as well as mechanical advantage. As stated earlier, synovial joints are diathratic. They are diathratic in that they are freely movable joints that are classified by the type of range of motion permitted. They are the most common yet most complex joint found in the human body. A classification of synovial joints is a point where 2 bones are separated by a narrow encapsulated space filled with synovial fluid with relative mobility. So let's get a deeper look at what a synovial joint actually looks like. As you can see, the synovial joint is surrounded by an outermost layer called the periosteum. The periosteum is a dense membrane composed of fibrous connective tissue that closely wraps all parts of the bone except that of the articulating surfaces in the joints, which is covered by a synovial membrane. Next, we have ligaments. Ligaments aid in stability. The greater amount of ligaments towards or near a joint increases the greater amount of stability the joint has. Next, we have joint cavity. The joint cavity is space enclosed by the articular capsule, which contains synovial fluid. Synovial fluid is secreted by synovial membrane, and the 3 primary functions are lubrication, nutrient distribution, and shock absorption. Next, we have the articular capsule. The articular capsule is made up of 2 layers, fibrous and synovial membrane. The external layer, fibrous capsule, is fibrous by nature due to the composition of dense, irregular connective tissue. Strengthens joints so bones don't fall apart. Next, we have the internal layer, which is the synovial membrane. The synovial membrane is composed of loose connective tissue, lines all internal joint surfaces except the articular surfaces, and secretes synovial fluid into the joint cavity. So, let's get a deeper look at the 6 different types of synovial joints found in the human body. The first 2 are gliding and hinge joint. As you can see, the gliding joint is a joint caused by a sliding movement in either direction of one plane. It is non-axial. This can be seen in the carpals, vertebrae, and tarsals. Next, the hinge joint is also movement in either direction on one plane but does not involve sliding. An example of this is the humerus, ulna, and is also uniaxial. Next, we have pivot and condyloid. As shown, pivot is allowing one-directional movement. A pivot joint involves a smooth, surrounded bone that can be turned in place like a wheel. It is also uniaxial. An example of this is the radius and ulna, and the action of this is supination and pronation. Next, we have the condyloid joints. The condyloid joints are capable of moving in either direction on 2 planes, with one direction typically being dominant. These joints are also capable of circumduction, which is a circular movement that involves both planes. It is biaxial, and these can be seen in the metacarpal and phalanxic area, as shown. Next, last but not least, we have the saddle joint and the ball and socket. As you can see, the saddle joint is very similar to the condyloid joint, but they are more apt to circumduction. They are also biaxial. You can identify the saddle joint through the carpal and metacarpal number 1, or also known as the thumb. This action is shown by moving the thumb forward and moving the thumb back. And last but not least, we have the ball and socket. The ball and socket has the most freedom of movement, allows rotation and range of motion allowed by the saddle joint. It is multiaxial. It can be seen in the head of the humerus and scapula. It is the movement that allows baseball players to throw a ball, or anybody in general. Next, like I said, we need to go over important terminology, such as origin, insertion, and range of motion. Origin is the attachment at a less movable bone, for example, the humerus. Insertion is the attachment of the more movable bone, such as the radius. The range of motion is what classifies a specific joint. For example, the 6 joints we just went over. And no movement occurs in the muscle if the tendon does not cross the joint. And that's very important because then it wouldn't be a movable joint. And that's what makes synovial joints classified as the most common ones and allows us to have movement in our body. Next, we're going to go over levers. Lever is a rigid object that rotates around a fixed point called a fulcrum. A load is what's moving, and it's the weight of the object, for example. An effort is just applied muscle or the applied force to the load. An example is the first class lever. As shown, the fulcrum lies between the applied force and the load. An example of this is scissors. But when you can see this action be exerted is when you're raising your head off your chest. What that exactly means is whenever you have that nodding moment, you're getting tired, your head's dropping, what allows your head to be pulled back up, that action is called a first class lever. So whenever your head drops and you bring it back up and it wakes you up, that's what you're experiencing. Next, we have the second class lever. As shown, the second class lever, the load, lies between the applied force and the fulcrum. This is an example of a wheelbarrow kind of action. This is exerted when standing on your tippy toes. So when you plantar flexion, which is pressing down your foot, so one stands on your tippy toes, they're exerting a second class lever. Last but not least, there's a third class lever. The third class lever, the applied force is between the load and the fulcrum. So this is the fulcrum, that's the applied force, E, and the load is R. This is an example of tweezers and forceps. This lever is exerted when flexing the forearm. For example, doing a bicep curl is a perfect example of a third class lever. For example, the load is heavily on the arm, and the effort is for you to pull it up, and that causes the bicep curl action of the gym. Raising anything actually, no matter at home or at the gym. And last but not least, as promised, mechanical advantage. It is the ratio of its output force to its input force. If the mechanical advantage is greater than 1, it has the lever produces more force and less speed or distance. And if the mechanical advantage is less than 1, the lever produces more speed and distance and less force than the input. And this concludes all the information on synovial joints. I hope you got a deeper understanding of what a synovial joint is and how much we use these joints in our everyday life. And this concludes. Thank you. Have a great rest of the week.